Hello, my name is Mace, and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of Medicare Basics. This presentation gives an overview of Medicare coverage, including Parts A, B, C, and D, as well as Medicare Supplement Insurance, Medigap. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions or comments, and with time permitting, I will be glad to answer them for you at the end of the presentation. Friendly reminder. Please speak clearly and avoid using inappropriate language. Maintain a polite and respectful tone. Thank you. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Areas Agencies on Aging, AAA, in Florida. The centers are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Medicare Basics topics. Displayed are the topics that will be presented for this presentation. Introduction to Medicare. What is Medicare? Medicare is a federal hospitalization, medical, and prescription drug insurance program. Unlike many other types of health insurance programs, Medicare benefits cannot extend to a spouse or other dependents. All eligible people must be enrolled individually if they want Medicare coverage. Medicare was created by Congress in 1965 as Title 18 of the Social Security Act under President Lyndon Johnson. Medicare became effective July 1st, 1966. Medicare is the largest health insurance program covering nearly 67 million Americans. There are roughly 4.9 million Medicare beneficiaries in Florida. While Medicare is administered by the Centers for Medicare and Medicaid Services, CMS, the Social Security Administration, SSA, is responsible for enrolling most people into Medicare. The Railroad Retirement Board, RRB, is responsible for enrolling railroad retirees into Medicare. Medicare versus Medicaid. Think care versus aid. Medicare covers health care for all those over 65 or those with disabilities. Medicaid offers financial aid for medical costs for those in need. Beneficiaries can be dual eligible. It all comes down to which program will pay for which services. Medicare eligibility. There are only two eligibility requirements for Medicare. Have U.S. citizenship and be over the age of 65. Both have exceptions. Other factors may affect a person's cost under Medicare, but they have no impact on Medicare eligibility, such as current health condition, employment history, Social Security, FICA contributions. A disability is a physical or mental medical condition that has prevented someone from working or is expected to prevent someone from working for at least 12 months or end in death. To be eligible for Medicare under a disability, the condition must meet Social Security's criteria, and the individual must have been receiving Social Security Disability Income, SSDI, for at least 24 months. End-stage renal disease, ESRD, is permanent kidney failure that requires a regular course of dialysis or a kidney transplant. Amyotrophic lateral sclerosis, ALS, is a disease of the nerve cells in the brain and spinal cord that control voluntary muscle movement. Those receiving SSDI because of ALS become eligible within the first month of their SSDI benefits start. Joining and changing plans. Beneficiaries are automatically enrolled when approaching age 65 if they are already receiving retirement benefits. Otherwise, they must voluntarily enroll during an official Medicare enrollment period. The initial enrollment period for Medicare surrounds a beneficiary's 65th birthday, and coverage is effective based on enrollment. Enroll within 3 months prior to 65th birth month, the effective at start of the 65th birth month. Enroll during your 65th birth month, effective start of the following month. Enroll 1, 2, or 3 months after birth month, effective start of the following month. The best time to enroll is during the 3 months before turning age 65. Medicare enrollment is facilitated through the Social Security Administration. It can be done online at ssa.gov. Joining and changing plans. There is an open enrollment period, OEP, sometimes called the annual open enrollment. The OEP is October 15th through December the 7th each year. During the OEP, beneficiaries can join, change, or drop prescription drug coverage. The change will be effective January 1st of the following year. There are special situations that give a person a special enrollment period, SEP, such as a permanent move out of the plan's service area, being eligible for financial assistance, or moving into, residing in, or leaving a long-term care facility like a nursing home. The time period of the SEP depends on the reason for the special enrollment period. Enrollment periods give a person the opportunity to join, switch, or drop Medicare drug plans. Those who qualify for financial assistance can only change plans one time per calendar quarter in the first 3 quarters of the year. We will talk more about financial assistance in a few minutes. If a beneficiary has missed their initial enrollment period, they have to wait until their open enrollment period. The parts of Medicare. Understanding the Medicare paths. Here is an example of the Medicare Basics handout that can be obtained by calling your local SHINE office. 2 paths to Medicare. There are 2 paths to Medicare coverage, Original and Advantage. Beneficiaries can choose one or the other, but not both. The first path is Original Medicare. Part A, hospital coverage costs include premium. No premium for individuals or spouse who pay 10 years of FICA taxes. Those with less will pay a premium. Deductible for each benefit period, and coinsurance. Part B, medical coverage costs include monthly premium, annual deductible, coinsurance. Medigap, a Medicare supplement plan provided through private insurance companies, bridges original Medicare cost gaps. Costs include monthly premium. Some plans include an annual deductible. Part D, optional prescription drug coverage offered through private insurance companies. Costs include monthly premium, annual deductible, co-payments. The alternative path for Medicare coverage is Medicare Advantage through a managed care plan known as Part C. Coverage includes Part A, hospital coverage, Part B, medical coverage. Most plans include Part D. Costs include some health care plan premiums, some include drug plan premiums, many have no premium, annual deductibles vary, copay and coinsurances vary. Part A, hospital. Displayed is a brief of the vast criteria for Part A, hospital. Original Medicare, Part A cost. Original Medicare is fee for service, meaning Medicare pays as services are provided. Original Medicare beneficiaries may go to any doctor, specialist, hospital, or other health care provided that accepts Medicare. While most beneficiaries don't pay a premium for Part A, they are responsible for a Part A benefit period deductible for inpatient hospital stays. Deductible, the amount a Medicare beneficiary must pay for health care before Medicare begins to pay. A benefit period, spell of illness, begins when a person starts to receive Part A covered services and ends after 60 consecutive days without Part A covered inpatient care. Other Part A services have different costs. Financial assistance is available to those who meet the qualifications. We will discuss this assistance shortly. Part B, medical. Displayed is a brief of the vast criteria for Part B, medical. Original Medicare, Part B cost. Everyone is charged a monthly Part B premium. Medigap. Medigap policies are supplemental insurance sold by private insurance companies to fill the out-of-pocket gaps in coverage under Original Medicare, such as deductibles, coinsurance, and copayments. The insurance companies that sell these policies must follow federal and state laws that protect people with Medicare. The Medigap policy must be clearly identified as Medicare supplement insurance. A Medigap policy only works with Original Medicare Part A and Part B. If a beneficiary joins a Medicare Advantage plan or other Medicare plan, their Medigap policy by law cannot pay any deductibles, co-payments, or other cost sharing under the plan. People under age 65 with ESRD may not be eligible for Medigap insurance until they reach age 65. Florida law requires insurance companies to offer Medigap policies to people under age 65 with ESRD. Anyone with Parts A and B are eligible for Medigap. This does not apply to members of Advantage plans, Part C. While people with Original Medicare, Parts A and B, can purchase Medigap policies at any time, they may not be covered by guaranteed issue right and therefore may be required to pay more for pre-existing health conditions. The best time to buy Medigap is during the Medigap open enrollment period. Medicare supplement plan types. A Medigap policy must be one of 10 standardized plan types. Each plan type has a different set of benefits. Each Medigap plan must provide 4 basic benefits. Part A, hospital co-payments or co-insurance. Part A, hospice care co-payments or co-insurance. Part B, co-payments or co-insurance. First 3 pints of blood per year. No matter which insurance company is offering these standardized plans, the coverage is the same. However, it is important to compare plans because costs vary due to certain parameters. Plan types example. A Medigap policy must be one of 10 standardized plan types. Each plan type has a different set of benefits. Each Medigap plan must provide 4 basic benefits. Part A, hospital co-payments or co-insurance. Part A, hospice care co-payments or co-insurance. Part B, co-payments or co-insurance. First 3 pints of blood per year. No matter which insurance company is offering these standardized plans, the coverage is the same. However, it is important to compare plans because costs vary due to certain parameters. For example, Plan A is offered by Company X and Company Y in the same zip code. Both policies offer the exact same coverage, but at different premiums. This is because insurance companies set their own premiums with costs rated by issue age, gender, smoking status, and geographic location. These policies must be approved by Medicare and the Florida Office of Insurance Regulation, FLIOR. Medigap eligibility and enrollment. The best time to buy a Medigap policy is during the Medigap open enrollment period, when beneficiaries have the right to buy any of the 10 different Medigap policies offered in the state. 6-month period beginning the month beneficiaries are 65 and have Part B. Guaranteed issue rights. Insurance companies cannot deny coverage and must sell at the best available rate, regardless of health status or pre-existing conditions. Applies during Medigap OEP, but could apply in other situations not during Medigap OEP. If beneficiaries miss the initial open enrollment period, they may not have guaranteed issue rights and could be denied coverage or charged more. Part C, Advantage. Medicare Advantage plans are bundled policies with Medicare covered health care under a single plan, including hospital, medical, and prescription drug coverage. Beneficiaries may need to use specific doctors that accept the plan or go to certain network hospitals to get covered services. Because all Advantage Plan members are still receiving Medicare coverage, they are responsible for paying the Part B premiums. Members may have to pay other costs, such as additional premiums, co-payments, or co-insurance for their covered services. The plan may offer extra benefits, such as coverage for vision, hearing, dental care, or health and wellness programs. It is important to note that people who join a Medicare Advantage plan are still in the Medicare program, still get all their regular Part A and Part B coverage services, still have all the Medicare rights and protections, will receive all health care services through the plan. They will be issued a plan membership card to use with providers. 4 main types of Advantage plans. There are 4 main types of Medicare Advantage plans. Health Maintenance Organizations, HMO. Members will receive health care from providers in the plan's network. Members have a primary care physician who must reapprove all referrals to a specialist. Some HMO plans offer a point of service option where members can go to doctors and hospitals that aren't part of the plan, but it may cost more. Preferred Provider Organization, PPO. Similar to an HMO, but members can see any doctor or provider that accepts Medicare and do not need a referral to see a specialist. Going to a provider that is outside of the plan's network will generally cost more. Private fee-for-service. Members can go to any provider that accepts the plan's terms, and they may get extra benefits. The private insurance company decides how much it will pay providers and how much members pay for services. Special needs plans limit all or most of their membership to people in certain long-term care facilities like a nursing home, people who are eligible for both Medicare and Medicaid, people who have certain chronic or disabling conditions. Special needs plans are available in limited areas. HMO point of service and medical savings account plans are other types of Medicare Advantage plans, but they are less common. Part D, RX drugs. Medicare Part D. All people with Medicare are eligible to enroll in a Medicare drug plan. People who live outside the U.S. or who are incarcerated are not eligible to enroll in a plan and therefore cannot get this coverage. People must be enrolled in a plan to get Medicare drug coverage. The coverage is not automatic like A and B. Medicare drug plans are offered by insurance companies approved by Medicare. There are two types of Medicare Part D plans. PDP, standalone prescription drug plans, add coverage to original Medicare and some other types of Medicare plans. MA-PD. Most Medicare Advantage plans, like an HMO or PPO, include prescription drug coverage. Costs vary depending on the plan. For coverage in 2025, people will generally pay a monthly premium, which varies by plan. Some plans have zero premiums. Others have higher premiums but might offer more coverage. Most plans fall between $30 and $60 per month. An annual deductible is the amount plan members must pay for prescriptions each year before the plan starts to pay. These amounts can change every year. Some plans offer a $0 deductible, usually for a higher premium. No plan can have a deductible higher than the standard amount. Co-payments or co-insurance. This is the amount plan members have to pay for each prescription after meeting the deductible, if any. In some plans, the co-payment, a set amount, or co-insurance, a percentage of the cost, is the same for any prescriptions. All plans must be assigned a tier for each drug on their formulary. Medicare and prescription drug options. Here's an example of the Medicare and prescription drug options 2025 handout that can be obtained by calling your local Shine office. Medicare drug plan cost. Cost vary depending on the plan. Plans must provide a standard minimum level of coverage. Plans may offer more coverage and or additional drugs, generally at a higher monthly premium. The actual coverage and cost of the Medicare drug plans can be found at medicare.gov or by calling a Shine counselor. For coverage in 2025, beneficiaries will generally pay a monthly premium, which varies by plan. Some plans have $0 premiums, others have higher premiums, but might offer more coverage. Most plans fall between $30 and $60 per month. An annual deductible is the amount plan members must pay for prescriptions each year before the plan starts to pay. These amounts can change every year. Some plans offer a $0 deductible, usually for a higher premium. No plan can have a deductible higher than the standard amount. Co-payments or co-insurance is the amount plan members have to pay for each prescription after meeting the deductible, if any. In some plans, the co-payment, a set amount, or co-insurance, a percentage of the cost, is the same for any prescriptions. All plans must assign a tier for each drug on their formulary. Once a beneficiary reaches the dollar amount shown in out-of-pocket drug costs, they do not have to pay anything for the remainder of the calendar year. This is called catastrophic coverage. The amount beneficiaries pay in some plans may vary depending on how much they have spent that year. Under the standard benefit, once the deductible is met, members pay 25% coinsurance until they reach the coverage gap. (2025) prescription drug coverage. Medicare prescription drug coverage is divided into 4 phases. Deductible. Beneficiary pays 100% of drug cost until the deductible is met. Deductible may be zero. It cannot exceed the standard amount shown. Begins January the 1st. Initial coverage. Beneficiary pays a coinsurance, 25% is standard, and the plan pays the remaining balance. Begins when the beneficiary's drug costs reach the deductible amount. The plan pays up to 75% in this phase. Catastrophic coverage. Begins when beneficiaries' out-of-pocket costs reach the amount shown. Includes manufacturers' discounts on drugs. The beneficiary pays 0% coinsurance for generics and brand name drugs or a small copayment, whichever is greater. The drug plan is liable for 20% of the cost. In a standard drug plan, Medicare subsidizes 80% of the cost for catastrophic coverage. This is called the reinsurance subsidy. Note, coverage percentages may differ for individual beneficiaries and plans. New 2025 enrollees who need expensive medications should also be aware of the new option starting in 2025 to spread out their drug cost in equal payments throughout the year, instead of having to meet the $2,000 out-of-pocket maximum in the first months of the year. Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Enrolling in Medicare. Steps to enroll in Medicare. Learn about Medicare. Review and compare coverage options. Original Medicare versus Medicare Advantage. Choose the coverage and use your Medicare coverage. How to enroll in Medicare. Call Shine 800-963-5337. Online at medicare.gov. Call Medicare at 800-MEDICARE. For Medicare Advantage, call the plan. Financial assistance programs. Medicare Savings Programs, MSPs. The Medicare Savings Programs are designed to have individual states pay for eligible Medicare beneficiary out-of-pocket cost. The programs are jointly funded through state and federal finances. There are several benefit levels in the program that are based on individuals' income and resources. We will review these levels in a moment. Application assistance is available at the state level through the Department of Children and Families, DCF. Limited benefits are based on eligibility and include Medicare Part A and B premiums, deductibles, coinsurances, and copayments. Extra Help. The Extra Help program, also known as the Low Income Subsidy, or LIS, is designed to help eligible Medicare beneficiaries with the cost of prescription drugs only. It is administered by the Social Security Administration, and like the Medicare Savings Programs, eligibility is determined by certain income and resource standards. We will take a closer look at these standards in a moment. Extra help also helps cover the cost of medications in what is referred to as the donut hole or coverage gap. Individuals who apply for and are approved for extra help will have the opportunity to change plans one time per calendar quarter for the first 3 quarters of the year. Shine handout. Many of you are here today because you would like to save on the out-of-pocket cost of Medicare and prescription drugs. Here is an example of the financial assistance for Medicare beneficiaries handout that can be obtained by calling your local Shine office. Medicare Fraud and Abuse, SMP. Senior Medicare Patrol, SMP. Senior Medicare Patrols, SMPs, empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Grant funded by the U.S. Administration for Community Living. 3 main project areas: conduct outreach and education, engage volunteers, receive beneficiary complaints. Medicare fraud and abuse. The difference between the two is intent. Medicare fraud and abuse continued. Prevent, detect, report. Prevent. Scamming scenarios. Scammers use Medicare numbers to bill for services and equipment beneficiaries did not receive or need. Scammers call or approach in public asking for personal information. Here are some tips to protect from healthcare fraud. Treat the Medicare card like a credit card. Share Medicare cards and numbers only with trusted sources who need that information to provide services, i.e. doctors and pharmacies. Keep addresses up to date. Verify people who call asking for personal information. Don't rely on advice or offers from strangers who call, visit, or approach in public. Never sign blank medical or insurance forms. Detect. There are 2 notifications beneficiaries can receive from Medicare that should be reviewed to verify that they do not have errors. Medicare Summary Notice, MFN, Explanation of Benefits, EOB. The MSN is sent by Medicare every 3 months. Beneficiaries may choose to receive the notice electronically, EMSNs. If chosen, they will receive a monthly email with a link to claims information. Prescription drug plans and Medicare Advantage plans are required to send monthly EOBs. SMP, red flags on an MSN. Your Medicare Summary Notice, or MSN, is very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. Your visit. This section provides information like the date you went to your doctor. Beneficiaries should keep your bills and compare them to this notice to be sure services match. Service descriptions. User-friendly service descriptions make it easier to know what the treatments were. Approved column. This column lets you know if your claim was approved or denied. Max you may be billed. This is the total amount the provider is allowed to bill. It is highlighted and in bold for easy reading. Notes. This section refers to explanation of service as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Report. Contact 1-800-MEDICARE or the Federal Trade Commission. Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medicare prescription drug low-income subsidy, Medicare savings programs, long-term care planning, insurance and financing, other public and private health insurance. Contact the local Shine program. Elder Source. The local PSA 4 Shine contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road, Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey for Shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope that this presentation has provided an insight into becoming educated and better assist you with your Medicare endeavors. Thank you.